Hi, everyone. Thank you for joining us in the room and everyone online. We are proud to be here for the Community Foundation for Northern Virginia's Insight Region report launch on the topic of youth mental health. My name is Megan Mocho, and I am a new board member to the foundation. I'm very excited to participate with the foundation. I love what they do in terms of grant making, but also in terms of initiatives like this, which really raise awareness and help our community. This past November, the Community Foundation adopted a new mission statement to advance equity across the region by unleashing the power of philanthropy and community leadership. To achieve this goal, the Community Foundation's work will be guided by 4 strategic priorities: social and economic mobility, racial justice and equity, inclusive systems of economic growth, and community resilience. I love that word, resilience. It's so important. We are committed to building a community that works for everyone here. As grant makers in the region, we awarded more than $7 million in grants and scholarships last year, helping to bolster the region's safety net, provide educational access and opportunity for students of all ages, support the region's environment and cultural sector, and advance equity for all the neighbors that we live with. But our grant making is only one initiative the Community Foundation offers this region. In recent years, the Community Foundation has become a community leader through the development of initiatives, events, and cross-sector collaborations to understand and address the issues that are critical to the economic, social, and civil health of this region. To this end, in 2020, we launched Insight Region, a center for community research that is growing hub for reliable, well-researched, and actionable data and analyses on issues that are critical to our Northern Virginia region. In its first year, Insight Region focused on understanding and promoting inclusive prosperity, which is increasing self-sufficiency, expanding economic opportunity, and forging pathways for long-term movements out of poverty for all of Northern Virginia's residents. We provided reports on housing, affordability, social and economic mobility, and early childhood education, something very dear to my little 5-year-old's heart. In partnership with regional partners, Insight Region has produced reports on minority-owned businesses in our region and supported initiatives such as the Northern Virginia Champions for Accountability with the Northern Virginia Chamber of Commerce. We're very proud of that partnership. And in 2022, Insight Region focused on mental health, and that's why we're here today. Today's event will launch a report on the shape of youth mental health, a companion report to the one we shared last March on mental health in our adult population. To share more about this important work, I'm pleased to introduce Eileen Ellsworth, the President and CDO of the Community Foundation for Northern Virginia. Thank you.
Thank you, Megan. Good morning, everyone. There's no microphone in the room here today, so I'm just going to do my best to project. Thank you all for joining us this morning. We have 200 attendees today, people that are in the room, obviously, and also people that are joining us online. So thank you all for coming and hearing more about this important topic. And thank you to George Mason University for hosting us. And as Megan mentioned, the Community Foundation spent most of 2022 on the issue of mental health. So for example, last March, we exclusively focused our annual Shape of the Region conference on the topic and launched this report back then, which is called Finding Our Way Back to Mental Health. And I found some of the data in that report absolutely shocking and to this day quite memorable. So the one that just never leaves my mind is the one that said 49% of all young adults, 49% of everybody across Northern Virginia between the ages of 18 and 30 were clinically depressed and anxious a year ago. Half of our young adults. I mean, 67% of individuals who find paying their monthly expenses, quote, very difficult, clinically anxious and depressed. 52% of people who lost income or employment due to illness, clinically anxious and depressed. So it was a wake-up call, and the Community Foundation decided to do what it could as a community foundation to help draw attention to the crisis and address it. So for example, we did a little email campaign and we ended up raising $121,000 to seed the creation of the very first permanent fund for Northern Virginia, focused solely and exclusively on mental health. We convened 17 anchor partners. Most of them were chambers of commerce, but we also had the regional commission, we had the university, we had the community college, a beautiful cross-sector of our anchors in the region to discuss the extent of the issue. We presented key findings from finding our way back to mental health to several regional and Commonwealth audiences. And we made a special one-time grant from our innovation fund to Smart City Works in support of their Mental Health Innovation Challenge for the 2022 Smart City Challenge competition. And I'm incredibly pleased to say that as a result of that work, it ended up inspiring philanthropy across the region, what we were doing and what others were doing, in a very concrete way. It has actually resulted in the creation of a statewide funding collaborative, a group of funders, most of them health foundation, like health conversion foundations or health foundations. Some community foundations, including ours, have come together, led by the PATH Foundation. Andy Johnson from the PATH Foundation is here with us today. And we are building a fund to improve access to mental health services across the Commonwealth, primarily through something known as the VMAP program. And the VMAP program was the brainchild of Sandy Chung. She is a local pediatrician, not a mental health professional. But she decided that just as an individual practicing pediatric medicine here in the region, she could help, and boy, did she ever. She decided that primary care physicians are often the vanguard, right? They're often the first person in the medical profession that realizes this child or this adult is having a mental health crisis. So couldn't we arm those individuals with some trainings, with some skill sets, so at least medication can be prescribed earlier than it otherwise would have? And let's just pause and think about that for a minute. I mean, we can all understand instantly how that type of early intervention can make a difference for someone in crisis. So it's delightful that this statewide funding collaborative is going to focus on expanding, for now, on expanding the VMAP program even further than it has already expanded across the Commonwealth. Today, the Community Foundation is releasing our latest data-driven report by Insight Region. It's called Shape of Youth Mental Health, Finding a Way Back from Sadness and Stress for Northern Virginia's Teens. And all I can say is brace yourself for another dose of cold reality about the mental health of our teens, a state of affairs that looms very large across our entire region and encompasses seemingly far more than the aftershocks of the pandemic. I am delighted to introduce Elizabeth Hughes, our Senior Director of Insight Region and the author of the report, who is going to now present the report's highlights and some carefully considered thoughts on the data. So join me in welcoming Elizabeth Hughes.
Thank you, Eileen. Thank you to everyone for joining here today and online to discuss this really important topic. So those of you who attended last year's Shape of the Region may remember some of the statistics that Eileen just alluded to. In winter of 2021, 39% of our adult population, so about 750,000 adults across the region, were struggling with clinical levels of anxiety and depression. This is an unprecedented increase from where we were before the pandemic at around 8% of the population. And then things began to level off, if you can call it, down to 28% as of last fall. Just so you know, we're going to be talking about, this is a comparator, so keep that number in mind. I have to tell you, the data were astounding, but they actually weren't surprising to many of the folks I talked to who were struggling with these symptoms themselves, or who had a friend, family member, coworker, or someone in their lives that wasn't doing well. If you can think of an office of 20 people, about 5 of those individuals were probably struggling with clinical levels of these symptoms. But after the analysis wrapped up, I kept getting the same question. What about our children? This is fascinating to know about the adults. There are different types of services, and we can think about therapeutic resources, but we know that something is going on with our teenagers and also younger generations. pandemic has hit them hard. We know historically that rates of major depression are twice as high in the teen population than in the adult population. What's the answer? And I didn't know the answer at the time. We didn't have the data, so we could speculate and do back of the napkin guesses, but we didn't know. And now we have a better answer to that. As of last winter, 37% of the region's high school students experienced a recent mental health need. So that's clinical levels of anxiety and depression. That's based on data from I have to read this because I'm not going to say it right. It's the 2022 legislatively mandated Virginia School Survey of Climate and Working Conditions. So this is a survey that's administered, required to be administered to every school in the Commonwealth, and it's done for elementary, middle, and high school students in alternating years. And they did this in winter of 2022, so about a year ago today. A third of students across Northern Virginia's 8 school districts reported feeling nervous, tense, anxious, or uncontrollably worried for more than half of the time in the past 2 weeks. And that's, again, the clinical marker of anxiety. And a quarter had lost pleasure or interest in doing things, or felt down, depressed, or hopeless for more than 2 weeks. That's the clinical marker of depression. If you're looking at the graphic, the dark blue bars are severe levels, so they're reporting feeling that way almost every day. The lighter blue bars are feeling that way more than half the time, and then the gray bars are several days in the past 2 weeks. So again, the clinical marker is where the blue line cuts off, but you can see there's actually a substantial portion that are in that mild range that might be at risk of having symptoms escalate and turn into something worse. So that's recent. That's the best comparator against what we know about the adult population, but most youth surveys don't ask about that. We were very fortunate that Virginia does, but the most common question is about persistent sadness and hopelessness and suicidal thinking. During the same time period, a third of our students had felt so sad or hopeless in the past 2 weeks at some point over the last year that they stopped doing some of their usual activities. That's called past year persistent sadness. 1 in 10 had seriously contemplated taking their own life. That's past year suicidal thinking. If you add up recent and or past, it's nearly half of high school students in Northern Virginia that were struggling with a mental health need. What do we know about middle school students? And these data are not directly comparable because they're a year prior because of that alternating nature of the survey. But you can see from this data 2 things. Rates are extremely high for persistent sadness and suicidal thinking among this population also, and there's also a tremendous range. So we know as data folks or non-data folks that averages can sometimes be misleading. They tend to obscure the range of needs. And in Fairfax County public schools, for example, there was a school where 16% of the middle school population was reporting persistent sadness. But then there was another school in the same county where nearly half of the students were experiencing persistent sadness. Similarly, with suicidal thinking, there was a school where less than 1% reported contemplating suicide, and there was a school where 1 in 5 had been contemplating suicide. And I point this out because we know that there is broad need, but there are also geographic, demographic, and socioeconomic factors that increase people's need also. Lastly, elementary school students. These data are different, so this is based on parents' perception of mental health concerns, and they're not comparable across time. But we do know that in 2022, 28% of parents of a school-aged child, so that's the light blue bar on the screen, so 28% noticed that their child was anxious or clingy. 17% observed sadness or depression in their elementary school student. 18% reported that they had trouble focusing. 15% had unusual anger, and 5% were lying, cheating, stealing, or bullying. How does this compare over time? And again, we don't have comparisons across all these. We aren't able to compare rates of clinical anxiety and depression because that's a new metric added to the school survey this year. But we can look at persistent sadness and suicidal thinking over time. And you can see that there has been an increase between 2019 and 2021 for persistent sadness. It went up by 6 percentage points, which is unprecedented. But the interesting thing about youth mental health is this is not a pandemic story. With adults, we went from 8% to 39%. This is a response to a crisis in the adult population. But for youth, this is a trend that got exacerbated, but it's been climbing over time. And these data are very consistent with national research too. So the Journal of the American Medical Association estimated that rates of, I think, anxiety had increased by 27% among youth between 2016 and 2019. So well before the pandemic, rates were rising steadily. Something was going on that was broader than a pandemic. Okay. So I've said before that averages tend to obscure the range of experiences, and our report examines 3 factors that help us understand who is struggling. We're looking at demographics and identity, we're looking at time use, and we're looking at relationship with parents and other adults. So first, our report looks at rates of sadness and stress among students in grades 8, 10, and 12 who participate in the Fairfax County Youth Survey. I switched data sources again because of data availability and because their data tool, which is awesome, allows you to dive deeper into some of the intersectionality of some of these factors. Girls and students in the LGBT community had rates of persistent sadness that were double that of their peers. And then students experiencing food insecurity also showed very, very high rates of persistent sadness. Age and race ethnicity mattered, but showed less variation, and the highest rates were observed among upperclassmen and Hispanic students. This information is actually pretty consistent with what we're seeing in the adult report. Those who identify as female, those are part of the LGBTQ community, those who are struggling with material insecurity, and also age, right? You can start to think about how the data that Eileen mentioned, the 18 to 30-year-olds had the highest rates. It was around a little less than 50%, but it's climbing as you approach 18, and then it peaks, and then it starts to go down as one enters middle age. But we'll get that in our next report. I've learned that I'm middle-aged from that work. But there's an important point to bring up when we talk about these rates when it comes to demographic groups, and that is we're limited in the data that we have. So this is measuring internal feelings, and we did not look at externalizing behaviors, which may be more common manifestations of mental health issues. So if individuals are engaging in substance abuse, if they are aggressive, if they are bullying, if there are other ways that they're showing that there's mental health needs, we're not measuring that, and that may be a better way for assessing mental health in certain populations. Again, looking at Fairfax County data, we see that these populations at higher risk of a mental health need were also those that experienced the most substantial increase during the pandemic. So girls, those part of the LGBTQ community, and those who sometimes or often went hungry in the past 30 days showed the largest increases in their rates of persistent sadness. This is an important point because we know that many students were on the edge prior to the pandemic, and it might be these same students that are now pushed into those levels of persistent sadness. The report also looked at time use, so following up on qualitative research and youth surveys, many teenagers describe the reason for their sadness and stress is not having enough free time. They feel like they are forced into being adult, that there's too much homework, that they're spread thin. But the reality is much more complex than that. If you look at the dark gray line, that's psychological stress. So how often in the last 30 days did you feel really stressed out? The light gray line is persistent sadness, and again, that's sadness or hopelessness that interfered with regular activities. Stress shoots down as you have more downtime. So this is the number of hours in the day that you have to engage in non-productive activities, so hanging out with friends, being with your family, playing, relaxing, but also attending to core needs like sleep and hygiene and eating. So those that had more time for all that stuff, not devoted to productive activities, tended to have lower rates of stress. But sadness didn't work that way. Sadness dipped in the middle. So those that had this balance, this moderation of activity had the lowest rates of sadness in this sample. So diving in a little bit deeper into the data, we're going to look at two aspects of total time use. First, productive time, and then downtime. Productive time is time spent in school, time spent on extracurriculars, either in school or out of school, time spent commuting to those activities, and then paid employment. And you can see that this idea of moderation being key is borne out in the different activities, that those with the lowest rates of sadness had about 2 hours of after-school activities and about an hour of homework. Now, these data have not been statistically tested at this point, and it would require further analysis, but there is a trend showing that this level of moderation might be really important. And it makes sense from youth development research that often focuses on students that are low engagement with school, that are disconnected from activities, that are not doing homework, that may be a target for intervention. But it also shows that populations that are spread thin, that are engaging in 6 hours or more of after-school activities, that have 3 hours or more of homework, may also be a target for intervention. The research suggests that 2 hours is the cutoff for homework, and I mean cutoff that wellness starts to decline and that academic benefits tend to plateau at 2 hours. Another important point with the data is that hours spent on homework does not necessarily indicate homework load, and it might also be related to time management or screen use, which we are heading right into right now. If I can find my notes on it. So when it comes to downtime, moderation is not necessarily key. Rates of sadness were generally flat among youth who spend an hour or less on a screen and then begin to rise steadily to 50% after they spend 5 hours or more computing or playing games. And I'm being precise in my definition because, again, we're limited by the data that we have. The survey that we use asks about time spent on a computer for recreational purposes or playing a video game. And that's because the surveys were written 10 years ago before anybody was glued to their phones, and they want to be consistent over time, and they don't change them. So you can imagine a student filling out this survey and saying, I'm not on a computer. I think there's like a Dell commercial that jokes about this. Like, what's a computer anyway? So there may be students out there that are not perceiving this question to be asking about their time on social media or on a phone because they're not on a physical computer. We know that nationally, about a third of students' time are spent on a cell phone, so 8 hours a day. And that's much lower than the rates in this survey, just so we have that. So while it's not a perfect measure, it does show you how fluctuations in total time on a screen are related to persistent sadness. And sleep goes in the opposite direction. So for every additional hour of sleep, rates of sadness dropped by 10 percentage points. And again, this is not causal, right? Sleep and mental health have a very complex relationship with each other where they can be both symptom and cause. So if you are feeling anxious or sad, you're more likely to ruminate, to worry at night and have insomnia and sleep problems. But there has been research that show if you just intervene with sleep and nothing else, you're not providing cognitive behavioral therapy, you're not addressing underlying mental health issues, you can actually improve mental health. So there is some amount of causality associated with additional sleep, and I can attest to that too. That I feel a little bit more ready to take on the day when I have a good 8 hours. And I'll just add for adolescents, the standard marker is around 8 hours for good sleep. Less than 6 is sleep deprivation. But youth development research suggests it should be more like 9. But there are the logistics of implementing these changes. Lastly, we looked at relationship with adults, and this should come as no surprise to anyone who follows youth development research and has common sense. Parents matter an awful lot. So the survey asked about 4 factors related to parents. Whether a parent has bullied, taunted, ridiculed, or teased non-playfully the student in the past year. If the parent or adult in the home has hit, beat, kick, or physically hurt the student. If the parent asks the student before making important family decisions that affect them. And then if they had a personal problem, do they feel like they could actually go to that parent to talk about it? And you can see that there's a pretty wide spectrum in terms of negative parental interactions. We have markers of what appear to be physical abuse. We have markers of verbal aggression or abuse. And then there's also markers of functionality in the home and how much students feel empowered to talk to their parents and how much they feel like they're listened to and can talk to them openly. So markers of trust. And you can see that as instances of verbal aggression increase, so does sadness. You can see that as physical abuse increases, so does sadness. And these are not surprising statistics, but they're sad nonetheless. And then also having parents that don't include you in decisions tend to have higher rates, and then students that don't feel like they can talk to their parent about a problem have higher rates. Parents matter a lot, but so do other adults in the community. The survey asked about whether students felt that they had a lot of opportunities in their school to talk to teachers one-on-one, and there are a few other markers, but this is one I selected to look at, and that there were adults in their neighborhood that they could talk to about something important. So it's not a perfect comparison because they asked about the volume too, so are there lots, and so there can be some variation there, but you can see that of students that felt like they did have those teacher resources, 35% had persistent sadness compared to 50% that did not. And then for adult in the neighborhood, 25% had persistent sadness who had that resource and 46% did not. And I just had a data point that's not on here that I wanted to mention. So the Virginia School Survey asks about if you feel sad, is there someone an adult you can go to for help and to talk to someone? And 57% of Northern Virginia's high school students said yes. But if we do the math, 43% did not say yes. 20% said no, and 24% were unsure. So half of our students feel like they have this resource, half are unsure if they do. So the Fairfax County, Fairfax County Youth Services tracks these factors related to relationship with parents, teachers, and other adults as part of their 3 to Succeed campaign, which is a marker of protective factors. So how many buffers does a child have in their life against negative behavior, against sadness and stress? It tends to encourage healthy eating and a whole range of good factors. And it doesn't necessarily matter which ones, it's more of that stacking effect. They find that the more assets a teen has, the less likely they are to experience psychological stress, which is the dark gray bar, and then persistent sadness, the light gray bar. What we found during the pandemic is the rate of students that are in this higher risk category that have fewer than 3 assets needed to succeed has increased. Prior to the pandemic, about 21% were in that higher risk category, and then in 2021, 28% were at risk. So there's been a decline in these buffers, which might help us understand why rates have increased. So our report focused on 3 factors that may be contributing to stress and sadness in a teen's life: who they are, how they spend their time, and what humans are there to support them when they struggle. What do we do with this information? What do we do as individuals? What do we do as schools? What do we do as a community? I'm probably not equipped to answer that completely, but I can talk about some of the takeaways, and then we can use that as a launching point for the discussion in the Q&A. So the report includes 3 recommendations. One about focusing mental health outreach, particularly on youth at heightened risk of sadness and stress, acknowledging the importance of sleep, and then expanding the number of trusting, supported adults in a teen's life. So first, we must consider how and to whom we target mental health intervention services and supports. Girls and those in the LGBT community have heightened levels of stress, as do those whose families might be experiencing material insecurity. But then there's also this issue around time use. So students with low engagement in school activities showed higher levels of risk, as did those that had hefty workloads. So they were engaged in a lot of extracurricular activities, or they had high levels of homework. So what can we do to help those students as they encounter stress related to low engagement or very, very high engagement? What can we do to help students who may be struggling with not having a parent or other adult that they can go to when they need help? Outreach can be formal, so that is marketed as specifically for mental health and delivered by a mental health professional. But I think we can go broader. So in our report on adult mental health, we discussed the role of wayfinders that are not necessarily lay people, but they're not mental health providers. They're your doctors, members of your faith community, parents, members of the community that are this first responder when somebody's in trouble. And we can think about that for youth too. So who do kids and teenagers go to when they're struggling? And it might be a parent, it might be another adult in the community, and it might be a friend. And so we think about, like, how can we expand broader mental health literacy? So comfort in talking about this issue, proactivity if you notice symptoms, and then what to do if things escalate, not just in our adult population, but also in our youth population. How can we empower students to know how to respond if they're the only person that someone talks to about a struggle they're having? Oh my gosh, sorry, didn't mean to do that. We also might need to get more creative about encouraging sleep, and this is like completely out of my realm, but we know it's very important, and we know that something is happening with screen time, homework, and extracurriculars by virtue of the fact that you only have 24 hours in the day, and something's got to give at some point. So if we can think about how to model good behavior with screen use at our home, if there are other strategies that we can think about that encourage sleep, and I know I'm just like riffing here, but it's definitely a clear link, and it's not an easy solution, but just something to think about as a community. Lastly, parents and adults matter a heck of a lot, and we need to think about how we're supporting these individuals and being in that role of support in times of crisis, but also support in times when it's not a crisis. And again, I mentioned mental health literacy. There's ideas about mentoring programs and how to connect more adults with youth. But it's important to point out that at the same time that 37% of our teenage population was struggling with clinical anxiety and depression, 26% of our adult population was struggling with anxiety and depression. And those rates tended to be higher among parents, individuals serving in the school system, and the other people that youth are actually encountering on a day-to-day basis. So I'll end with a broad recommendation that if we want to help our kids, we also need to help ourselves and make sure that we're getting healthier as a community, not just a single population. We are ready for questions from the audience. I'm going to go sit down there. I really thank you for your time and for listening and your interest in this topic, and look forward to discussion. Yeah, so for this particular study, we don't have the data specifically on, again, even broad screen time use other than computing and video game use, and we certainly don't have it on social media. But there is a growing body of research that does talk about the specific impact of social media on youth mental health. And again, I'm not the right person to dive totally into the data, but it's interesting. There's a bidirectional or a self-reinforcing thing that happens just like with sleep. So we know that individuals that are already at high risk of anxiety and depression may seek respite in social media. That may be where they feel like they can go to connect with others that are struggling with these issues. It may be a way to create distraction from those rumination and worry, but it can also aggravate issues. There's a really good researcher, and I'm not going to know their name, but I'll look it up in the end notes and then I'll tell everyone, that looks specifically at this issue of like, why did mental health start getting worse 7 years ago? It's not a pandemic issue, it's something else, and her hypothesis that seems to be borne out is that it is related to social media. And she cites a number of articles that are able to get at that causality issue with pretty good initial findings suggesting there is a relationship. So again, I can't speak to Northern Virginia particularly, I can't speak to anything from the data, but there is a body of research suggesting that it can be harmful, particularly for those that are already at risk. It could be. So we know that from the survey, 63% of the whole student body participated in the study, but there is always a risk of the sample that you have not being representative of the whole. So there can be students that are struggling in particular that are not participating in the survey, and that's a limitation not just with the Virginia school survey, but with the Fairfax County Youth Survey, with the broader statewide survey that it's part of, and the national BRFIS. Sorry to use the acronym here, but this is a limitation of survey research, but it's a really important point and something to look into that depending on when you administer the survey, we may have different results. The data were not available to analyze at the high school level, though it is publicly available. So anyone who is interested in looking up a particular high school, the Northern Virginia region, can go to the Virginia Department of Criminal Justice Services website and download the report for that school. But I did not examine factors related to individual schools and how it related to rates of clinical anxiety and depression. Sure. This report uses the standard demographic computation of non-Hispanic white and Hispanic any race category.
I think I'll just say for myself, as adults of teenagers, I'm struggling, my teenagers are struggling. So I appreciate what you said actually around how this 7 years ago, that data is really representative of kind of where we are today. Mm-hmm. And I would also like to mention one thing that we talked about is that in school, kids are told to use their screens also to do their school work. So it's adding another layer of the screen time challenge, I think, as well too. So just from our
I know
we've talked about this.
It's all problems, no solutions, but we do talk. It's not my catchphrase. We do talk in the report how it's very hard to talk about what good screen time is and bad screen time, because it's not just schoolwork and non-school work. It's partly about how you are interacting with the resource and how it makes you feel, and how do you make that distinction? I mean, it's sort of like a bad relationship, right? Like if it's making you unhappy, maybe it's time to stop.
Yeah.
But yeah, broadly, go ahead. Sorry.
So this has nothing to do with your data, but it's part of this whole discussion. And I recently heard, and you're going to ask me what was the source? I don't have the source. That Gen Z, is the first generation that grew up from birth with cell phones. My two kids are millennials, right? My memory of their teen years where they were on the phone the whole time, they look at Gen X and say, oh, thank God we're not them. Like that we actually had a few years before that became such a phenomenon. So I was reading that there's some evidence apparently that all that screen time, all that cell use is rewiring our children's brains. Literally rewiring their brains to the point where someone I heard on TV recently say that it's very hard for many of them to sit through an hour-and-a-half movie. And it's not because they want to check their phone, it's because they can't concentrate that long.
Yeah. It bears pointing out that during the pandemic and shutdowns that we all lived through, social media and cell phones became a lifeline for many teens. And research by, I think it's Pew, has looked at how relationships with friends have even changed over time, that even before the pandemic, that's how you met up with friends. And part of it is because people are so darn busy that they don't have time to, I'll date myself, but like go to the mall or talk on the phone, that it's more efficient to engage on a screen. And so how do we, again, limit the positive, limit the negative, but also allowing for that positive and the way that the world is shaping up to continue.
And I will share just one other data point, again, unrelated to this study, but related. So in 2018, the Cigna Health system did a study on loneliness in America, and at the time found that 51% of Americans self-reported as feeling lonely either all of the time or most of the time. Wow. Half of Americans. So for the fun of it this morning, I Googled Cigna study on loneliness to see what's new, and it pops up. Now it's 58% of Americans feel lonely either all of the time or part of the time. And I have to believe this is related. You know, it's related. There's something about the American culture and this cult of the individual that is so much a part of it that is making us lonely, that screen time has to be exacerbating. How can it not? You're not cruising a screen with others on a team. You're doing it alone. So, I don't know.
You know,
I don't have any answers either.
The million-dollar question we get is how did the pandemic actually impact mental health, and will these issues go away when the pandemic is over? Because the pandemic did not change everyone's fundamental biology or their predilection to anxiety or depression. Something actually happened. And the research show, particularly with the adult population, that it is the accumulation of stressors. So if you think about those buffers that like help, there's accumulation also of stressors, and it doesn't matter which ones, that if you have a child that you are taking care of during the day who cannot be in school, if you're worried about being able to pay rent, if you are worried that a family member is going to die, there is this accumulation of stress, and at the same time, there is a loss of connectivity, to Eileen's point. There is increased loneliness. And I don't think we, adults and children alike, are yet aware of how to re-engage as a society in part. We don't know how to break some of these habits of engaging with people on social media, conducting everything remotely and over a screen, and that's probably part of it. And I don't know what the solutions to it are, but it's certainly part of the world that we're inheriting now.
But it makes so evident your last recommendation around significant adults in the lives of children, and the data, you can see it in the data, the difference that makes in their sense of sadness. The more caring, significant adults in a teen's life, the happier that individual. So if you're looking for a grassroots solution, there you have it. Offer yourself to children as surrogate aunts and uncles. We when our kids were really small, we moved here to Northern Virginia into a neighborhood where no one had family around. So we became aunts and uncles to each other's children. In an informal way, obviously, but it worked. I mean, it worked. Our kids to this day talk about that. Yeah.
I am confident that there are data out there, and I did not look at them for this study. So the Virginia School Survey is a rich data source, and they ask not just about these clinical levels of anxiety and depression. They also ask about the school climate. So is there bullying? Is there violence? Is there fear? What resources are available? And then also, what is the mental health of the staff and the teachers that are working in these environments? So I don't have the answer at hand, but again, if you were interested in learning more about that from your individual school perspective, Virginia School Survey could be a very good resource, and then the individual school districts will likely have that, but it wasn't looked at in my report.
I think that so another question was asked is, what is the foundation's plan for moving forward with this data in mind? And so I looked at the data, we talked a little bit about this, and the reality is we, as Eileen mentioned, and as Megan mentioned earlier, from last year's event that we have a fund, a mental health fund, and I think what we will do in the next year, so we're completing this year, but in 2023, potentially use the data and invest in organizations that are doing some of the things we talked about today around mentoring, exactly, and providing services. And we can figure out what those services are in the schools, and maybe supporting organizations that are supporting schools in providing additional mental health services for kids as well.
I'll just say one other thing. We've had a grant round for 10 years now. We call it the Healthy Kids Grants, and it was launched in partnership with Innova 10 years ago, and it was intended to address childhood obesity. It was intended to address physical health and well-being, and they're very small grants, $1,000 to $2,000 to schools. Any public school at any level, anywhere in Northern Virginia can apply. And you'd be shocked at the programs that, teachers and administrators and PE teachers on their own nickel, on their own time, are doing in schools to help the health of the children in the school. And the one I remember, one of the first years we did it was Westfields. There was a science teacher. She was the science teacher, but she liked to run. And so she started an all-girls running club. And the first year she did it, she had 25 girls in it. And the second year she had, 50 girls in it. And by the fourth year she had 200 girls in the school showing up at 6:15 in the morning to run, So this cycle of grants that we had were always focused on physical health. Well, we were focused in 22 on mental health, and when we saw the data, we said, what have we got that we can just turn into that direction? So the Healthy Kids Grants in 2022 all went to schools for mental health initiatives.
They went for physical and mental,
For both.
but the challenge actually, post-COVID, truthfully, and the timing, and I'm hoping because of this data also we can expand it, is that we didn't receive so many applications because I think teachers were trying to just get it together in the classroom
Right.
and didn't have the capacity. We were kind of ahead of the game thinking, oh, there's this need, let's provide this opportunity to teachers, and the reality is they weren't able to really submit that many opportunities to us. So we received a couple of them, but I think based on this data, we have an opportunity to really expand that and maybe frame it with this data saying that this is what our focus is. And that can potentially help the teachers as well in identifying an opportunity for them to apply.
So because that circle happened early in the year, we did it as we usually did it
Exactly.
and focused it on health. And
That's
then
right.
we realized what
That's
was
right.
happening with
That's
the
right.
mental health of Northern Virginians. And we have some donors that are committed to that grant cycle and just poured in a bunch of extra money so we could do a second round of grants from that cycle
Exactly.
dedicated to the mental health of kids in schools.
Exactly.
Is it just for schools, or could nonprofits that work with schools apply for those grants?
Healthy Kids, yeah, go ahead.
Oh no, Healthy Kids is an actually school-based,
It's school-based.
Grant because most of our grants are actually not open to schools.
I see.
So we create that opportunity. It also allows teachers to be a little more creative in the classroom. And in this case, actually, a lot of physical education teachers are the ones who apply. So it really expands the reach. Hopefully, we were trying to get to, and if anyone can help us do this, that would be great, is get in touch with the school counseling community, actually, that they could be the ones who apply for these mental health grants. So that's the goal, and we'd love to expand that, and that may be a direct, actually, the easiest way to have this happen, which will happen probably in the springtime. So any help around that would be great.
So unlike many community foundations, but like some community foundations, we distribute our discretionary grants through using volunteer committees who do all the reading, who do all that work, who gets facilitated by Sari and her team, but they make the recommendations. And even though we are doing the work to build these permanent funds from which these grants come, and even though they live at the community foundation because they have to live somewhere, it's odd, but we feel that we don't really own them. The community owns them and needs to be responsible for making the decisions on who gets them. So we simply facilitate that process.
Exactly. So I think we've reached time.
We're at
But thank you, everyone, for joining us. If you have any questions, first of all, there were a lot of additional questions we couldn't address, but please feel free to reach out to us, and we look forward to hopefully supporting some solutions as we've been discussing today. So thank you for joining us.
Thank you.
Yes, I'm happy to talk to you.
Very organic, very natural. It was absolutely spectacular. Nice job. Thank you. Thank you. Yeah, well.
Good Shepherd Housing really focuses on supporting families within our communities, not only looking at providing housing stability, but also thinking what are their goals. When families don't have stable housing, and they're spending each day trying to figure out, where is it that we're going to sleep tonight? How is it that I'm going to be able to get to work and get my family to school, and all of these different pieces? It doesn't really allow them the opportunity to be able to focus on other areas that might be able to help them achieve self-sufficiency. Good Shepherd Housing made a strategic decision a number of years ago to be able to purchase aggressively housing units themselves. And by owning those housing units, they're able to control the rent associated with them and have been able to keep those rents down and affordable to families, despite the increase in overall housing rates that we've seen over the last few years. The services can really be a lifeline to a family. A lot of the families that come into our housing are coming from a variety of difficult situations. So in addition to be able to providing the stability of housing, the ability to have somebody to go to be able to ask for help who's there focused on you, can really make all the difference for some of the families that we've worked with.
I'm originally from PG County, Maryland, born and raised. Currently, I work at Virginia Hospital Center in the admitting department. I have a set of twins, they're 15, and they have a younger sister, she's 13. As of about maybe 3 or 4 years ago, I separated from my husband due to just a really abusive relationship. So I left everything, car, house, clothing, belongings behind, just to try to provide a better environment for my children. My children stayed with their grandparents for some time while I got myself mentally and emotionally together. My separation from my children was, I would say, maybe around 1.5 years. I felt like I had failed as a parent. It did hurt quite a bit to miss certain things that were going on in their everyday life. It kind of made me feel like I was a missing piece, and they were a missing piece for me. One day I stumbled across Good Shepherd Housing. This happened to be one of the really down days for me, so I think it was really God sent for me to find Good Shepherd. I sent over my application. I got a call within 72 hours, and maybe about 30 days after that, I was actually able to move into my own apartment where I could just provide and have a home for me and my 3 children. The first time I came into my home, and I literally sat in the middle of this floor and I cried. I was so grateful. And it took me a couple of days to kind of realize this is yours. I had never been on my own before. I've never had my own household, to run my own household and have my own space and just be the queen of my own domain. And it felt really good to walk in and see a space that I could call my own for me and my children. Because I control the temperature, I control my own environment now. I can decorate how I want to decorate. I can cook how I want to cook. Me and the kids can watch TV, we can watch movies. So this has definitely been a safe haven. What hasn't Good Shepherd House done for me? I have benefited from backpack drives, back to school drives, Christmas, food banks as well. They assist with schooling. They gave me financial improvement classes, and I keep in contact with a case manager every month. We go over a plan for me to just kind of see where I am. And she helps me reach out for those resources, and I'm so happy to have her and Good Shepherd on my team, because whenever I need something, they are always there for me. And I feel so supported in a way that has just added to my success, and it keeps me motivated, most definitely. I feel so grateful to be a part of the Good Shepherd program.
Our volunteer drivers are more than just drivers.
MB Rides makes it so I do not have to depend on friends or family. I can be independent.
So you really do form friendships with the people you're supporting. So it's not just a client-driver relationship.
They are my guardian angels.
MB Rides was initiated in 2014, and it was a response to a growing concern for seniors in Fairfax County who wished to age in place but faced not a lot of options for transportation if they were no longer driving, to help non-driving seniors get to their medical appointments or get to the grocery store to access food. And there were many volunteer driver organizations that were operating within the region. However, they did not have a lot of coordination between each group, and the idea was to create a coordinated hub for these types of programs.
NV Rides is our mothership. They help us with DMV checks and criminal background. They pay for each driver to get that background check. They set up guidelines that we should be aware of, like having insurance for our secondary insurance.
NV Rides provide the software support for us. They provide marketing support for us. They help us recruit new drivers, and they look for opportunities for us to serve more. So it works both ways, but they are very supportive of us, and we appreciate it.
Oh, Ride Scheduler is wonderful, and I hear from volunteers all the time that they love it too. I think it's great when I am able to offer a new potential volunteer driver the luxury of choosing a month out. If they were to go on vacation, they can now look in the Ride Scheduler and see, I really want to help somebody the week of September 1st. It's a really easy platform to use.
We go out to lunch and we have a wonderful lunch, a conversation, and that takes away a lot of that loneliness that I might have by not having anybody around. They're always on time, very dependable. I don't have to worry. They take the stress out of me of worrying.
I retired from my medical practice about 4 years ago. Unfortunately, I had to take away the licenses of some of my patients because they were unable to drive for medical or physical reasons. And so I knew that that would be a very important thing for me to do. I've been a volunteer driver for about 4 years now.
It's been a lot of fun, and it's rewarding after you've done something nice for someone and they appreciate it.
I have developed great friendships and have gotten the independence that I desire.
You know that you're doing good for people, that they need the support, and you know that they appreciate what you do. So you feel appreciated as well as satisfied that you're contributing to the good of the world.
They give it from their heart, and they feel like they're brothers and sisters and mothers and dads to me.